everybody to our second public meeting on best uses of the ARPA funds. It's obviously a little lighter than the last one, but that's probably attributed to the amount of people that showed up the first one that had something to say. But obviously, every comment is important, and we're not gonna let anybody go away here without having their opportunity to speak. First of all, I do want to introduce the panel. From my left, Natalie Mello from the neighborhood groups, Tatiana Rock from Liberty, Mike Dion from CDA, Deb Fastino from Social Justice.
Coalition for Social Justice.
Coalition for Social Justice. I make sure I say that right. Chris Peckham is one of our city councilors. Paul Furlan runs the water department, and Jim Carey's also here from Liberty Utilities. A few people had to excuse themselves from tonight's meeting, but I'm sure they'll watch the tape and they'll get the notes from the meeting. Before we go too far into this, we do want, especially anyone new, to get a brief overview of this act and what the constrictions are on the use of the money and where we're going to go. So I'm going to introduce our Chief Financial Officer for the city, Mary Sahadi, to come up and do that. And again, thanks everybody for coming out.
Thank you, everyone. As the mayor indicated at the last public hearing, we did have a number of people, and so we were able to answer a number of questions that evening, and we're certainly here to answer them for you all as well. And you're all welcome to have a few minutes at the mic in order to give us what your concerns are for the use of the American Rescue Plan Act. This was an act that was passed by Congress. It was a $1.9 trillion package, and it included a number of areas. The one that we'll be speaking of this evening is the area with regard to the state and local government. The city of Fall River was fortunate in the allocation to be allocated $69 million. At this particular time, effective June 1st of this past year, so June 1st, 2021, we have received $34 million of those monies. The second half of the monies should be received in approximately 1 calendar year. So we're expecting that the second half of the $34 million, or the second half of the $69 million, $34 million, will be received in June of 2022. We need to obligate these funds by December 31, 2024, and we will have some periodic reporting to the Treasury. Just today, the Massachusetts Municipal Association did a webinar on the first requirement, and we are going to be receiving more information on a regular basis. The Treasury on a regular basis provides us with frequently asked questions and the answers there too. And the last set of frequently asked questions was received on July 19th of 21. We are included in what's referred to as Group B, or Group 2, of the Treasury direct entitlement municipalities that have received these monies. Group 1, or Group A, are the most of the counties and the city of Boston, with the exception of Barnstable County, I believe, is in the same group with us. All that means is there's a little bit difference in the reporting requirements. The use of the funds, you may have read about this at this particular point, but the use of the funds comes down to 4 or 5 categories that we can use the funds in. So it needs to support public health expenditures, and in some instances that is very similar to the CARES money that the city had received earlier this year with regard to PPE and other health expenditures that we've incurred. It also includes our ability to address negative economic impacts, which are caused by the pandemic. So again, we need to look at those negative economic impacts that were caused by the pandemic. Replacement of lost public sector revenue. That's one of the areas that the city is intending on using a portion of the $34 million, where we had lost revenue from or as a result of the pandemic, as a result of government really realistically being closed down. The biggest area in terms of investments in municipal assets is the area of investments in water, sewer, and broadband infrastructure. The Act itself is very clear as to what we can't spend the money on. So we can't spend the money on pension expenses that we have. We can't spend the money on debt that we had incurred prior to this act being passed by Congress. We can't put the money in a rainy day fund for future use. So the idea of the utilization of these dollars is to use them to offset the economic downfall the communities had as a result of the pandemic. In your brochure, I think everyone has a copy of it. There on page 4, there is a list of eligible categories that we can certainly talk about this evening if you would like. The revenue and city services, again, it's to mitigate those negative impacts. It's to rehire staff for city services. Last year, the city was certainly in a flux in the sense of there was so much uncertainty as to where the state was going with the governmental or intergovernmental state aid that we receive. And so the city took the approach to reduce the general fund operating budget by any positions that were vacant. So one of the eligible categories is the ability to rehire or hire some of that particular staff. There's a category for premium pay, and this premium pay category, again, is for those people that were affected by the pandemic. So healthcare workers, grocery store workers, people that had to work during the pandemic are going to be eligible under the provisions of this act for something referred to as premium pay. The negative economic impact that we just talked about will allow us to not only provide aid to households, nonprofits, and small businesses, but also to affect industries like hospitality industries, travel industries, and tourism as well. And then again, public health, a lot of the same categories that the CARES money was available for in terms of purchasing personal protective equipment to combat the COVID expenses. The infrastructure, again, water, sewer, and broadband, specifically to improve access to clean drinking water, to support vital wastewater and stormwater infrastructure, and to expand the broadband internet in areas that have limited internet services at this point. Services to those disproportionately impacted. Again, education would be an area where we could particularly use some of these monies for early learning or for social, emotional, and mental health services, for child care services, and certainly for community violence interventions. So there are a number of frequently asked questions. We didn't bring those with us this evening, but a lot of the frequently asked questions will describe in a lot more detail what these dollars can be used for. Lastly, but certainly not least, is the area of housing. Again, we can use some of this this ARPA money rather, to support our housing issues that we have here in the city of Fall River. The Governmental Finance Office Association, known as the GFOA, they have provided us with some guidance as well, being sure that we are making sure that we're not using these monies for first-time or one-time expenses that will create a deficit going forward. So we're being very cautious to make sure that we are using these monies in a very prudent way. We have a great committee here. We meet on a regular basis. We've met a number of times now. People have come with their ideas with regard to where the best use of this ARPA money is. Again, the first reporting, the interim reporting on the first reporting is going to be for expenditures that have occurred after July 1 of '21 through August 31, so it'll be a very short reporting at this particular time. Most communities from the discussion today at the MMA have not spent any money, so there really isn't going to be a lot of reporting then, and then it will be a quarterly reporting going forward. And the reporting is going to require a significant amount of work in the sense of if we determine that we have a particular use for a program. So let's just say that, and I'm not sure where each of you are from, but let's just say that the aid to small businesses is a choice of the use of the ARPA money. Then a narrative would have to be created in terms of a program narrative description of what that particular aid is for, and then an obligation would need to be set aside, and at that point, the expenditure can be made. And then the city would be required, going forward from that point on, to do a monitoring of those monies. So that's the general process that we now know that we probably didn't know a month ago with regard to how this money is going to be monitored going forward and reported going forward. And in terms of the expenditures, the city is being very cautious at this point in terms of setting aside any particular amounts of money, but I can tell you from the meetings that we have had, there have been individuals that have come forward that have provided the mayor with some great ideas as to where this money should be allocated to. And at this particular point, the only use of the ARPA money that we have committed, although not yet expended, but obligated, would be the lost revenue in the FY22 city general fund budget. I don't know if anyone has any questions.
I'm a resident since 7 years, homeowner since 87, 90 years. And I've seen the city going down on the way we feel about it. The city is full of trash. And I am not just talking around, the center of town. I'm talking about all over the city. That has a negative impact in our mental status as we go around. Because we compare ourselves to others. How are the others better than I as the president of the city if they present much better quality of life? And I see that the only thing which is to me very minute that and I'm not even sure if city services city services would include a general uplift or a facelift of the city. I see a multitude of these little programs here. Monies go here, monies go there, and monies get spent, and then once the money is gone, the money is gone. And I think that by allocating the money to this multitude of points that I see here would be a waste, because things would fall back. I have not seen a massive effort from the city. And I'm not talking about the actual administration, I'm talking about as a general way of governance of the city. There is never a general effort to facelift the city. The first thing that I see when I go to my home is as I go to it, as I go through my yards, or to my front entrance, or to my side entrance. It's the way it looks. It's the city it's the street that I park. Those are the first things that makes you feel good. And everyone talks about mental problems. The situation, your physical situation is a great deal has to do with your mental state of mind, of being, because you never feel good about yourself. We must feel good about ourselves before we can help others. Once we feel good about ourselves, then it's like a cascade, it will go on. But I don't think that all of these administrations have made enough efforts to impounding people, to creating people that need to be cleaned, that need to clean after yourself. And whoever doesn't clean, yeah, let's spend time on people finding others that are quote-unquote pigs. And I should not use the word, but sometimes we have to be a little harsh on the words that we use to create an impact, to create an opinion. So I think that by looking at all of these, and unfortunately, and I don't know why, maybe I was not aware that there was a meeting on the first time. These to me, and to many people that I hear, I talk a lot, I listen to the radio a lot, and because I am Portuguese, I like to hear my own people of my group talking about these things. And I listen a lot to Voice of the Immigrant. I invite people to listen to the Voice of the Immigrant, see how the people feel negatively about the city. Not that we want to be negative, no. I'm still a resident of the city after all of these years. I could as well move out and live up. I at one time, I was offended by a city councillor that told me, Louis, you are very negative. You called this city, weak city on the radio. And I said, did I say something wrong? Yeah, but there are ways to say things more positively. Yeah, but after so many times trying, you just give up. And I'm giving up at that time. But I never gave up. I never moved up. I could move out. I'm still trying. You see me sweeping my street, the side in front of my house. I live in a neighborhood. I don't live in the highlands. I live in a regular neighborhood, Liverpool Street, right behind the hospital. And I cleaned, because to me, it impounds the feeling of me being good to my city and also to myself as a person, to my mental state. And I see that very little of this 69 million can be used in this facelift of the city. Maybe, the mayor is here, maybe some things could be used using that city services.
You know, this is, I'm sorry,
So
this is about suggestions, those guidelines come from the federal government. We don't write those.
I understand.
That's what I'm saying. So they tell you how they want you to use the
Yes,
money.
and I understand
agree
that,
with you.
Mayor.
I agree with you. I wish we could use the money for exactly what you're saying. A couple more street sweepers, a couple cleaning crews. I agree, but that's not what we're here tonight about. We're here tonight to get ideas on what you think in that sheet that's allowed, how we should use the money. We go through this all the time, and I wish you were right. But that's what we got to go by.
And I see your point, but under some of these points, is there any way that we could kind of funnel?
Well, we do. We try to move things all the week today. Myself and Tim and Mary had a discussion about public safety and how to move that money. We looked at probably 50, 60 cities across the country and how they were doing it. So we do try to follow other people's guidance. And like I said, if you told me tomorrow that you could take X amount of that money to buy a few more street sweepers and hire specific cleaning crews, I would do it. But that's not what's allowed on the paper in front of you, and that's what we're here to talk about tonight. I agree with you. That's why we do cleanups here. There was one last weekend. We do as many as we can, and we're going to do more before the rest of the summer. You're right. We need to get our city cleaner, and it starts with the people and the people who work for us. I agree with you. I do. I'm disappointed. Sometimes I drove down the street on North Main Street the other day. I wanted to get out of the car and pick the stuff up right then. But that's what we're dealing with right now. Training, guidance from people like you to help us. I support that 100%.
But again, if there is a way that you could
Yes,
channel
we can do
some
it.
of that
We will,
way,
yes.
using these guidelines,
We definitely will. So we're going to take each one of the eligible categories, and as the mayor indicated, we are looking at every avenue in order to spend the money wisely to make Fall River a better
As
place.
Mike just said, there's another bill coming right behind it. It's an infrastructure bill that may target some of the things you're specifically talking about. City streets, cleanup, that's the next bill. But we're on the ARPA tonight. So,
Can I just
go
say one
right
thing?
ahead.
I respect you for cleaning in front of your house. It's all business, anyone that does that, and if everybody did that, maybe we wouldn't be in so much of a mess that we're in. So we need to take responsibility, and this is an unfair as city residents, tenant, landlord, whoever. So
Yeah, I appreciate it as well. My husband sweeps the gutters as well in front of our house, so.
Maybe we're not enough. Maybe we have to maintain.
More people, I agree.
that's what I.
Does anybody else have suggestions on how to use ARPA money that wants to address the committee tonight? You want to go to the middle and use the mic, please? You got to talk to me, don't forget. We can hear you, it's a small crowd.
Sure you can
Go
hear me.
ahead, go ahead.
Okay, I came tonight, my name is Carol Baraki, and I sit the Community Benefits Committee meeting at St. Anne's Hospital. I've done that for probably 15 years, and prior to that, I was an employee risk management, infection control, surgical ICU nurse. I did work in the emergency rooms. In that period of time, I witnessed and I experienced all the stresses that our first responders go through. I am not currently working for St. Anne's Hospital. I only sit there on an advisory committee at this point. I sit there and I listen to all the needs of the community, from housing to what you're addressing. I just listen to it all. Anyway, one of the biggest things that comes up and what we've all dealt with in relation to healthcare is the stress of everyday life, the things that we run into every day. It's getting to the accident scene, finding the tragic results, whether it's involving a child, whether it's involving an adult, whether it's involving one person, two people, or whatever. My experience has been that what happens in those few moments goes home and affects not only the first responder, it affects all the emergency services, it affects their families, how they deal with life in general. In the result of COVID, they have dealt with more than they have ever dealt with before. And as a result, as with every other piece of data in this city, your suicides are up, your homicides are up, everything in the first responder population is also up. And they're having a very difficult time dealing with it. In response to that, I now have formed with my partner here an organization that what we do is we provide mindfulness activities and retreats for first responders. We help them deal with those everyday stressors. We have had some people from your Fall River area attend our retreats. They're extremely emotional for them. They claim that it has been extremely effective for them in relation to how they can deal with things ongoing. We try to provide ongoing support for that after that. That's essentially what we do. And I have some brochures I could leave, and if we had the opportunity to speak later, if anybody had any additional questions. Where we also experience the same problems with not being able to come up with funds. We provide these services free of charge to the first responders. We pay for everything. We pay for the lodging, we pay for meals, we pay for the peer support, we pay for the yoga, but we can only do it by what fundraising we can do, what grants we can apply for. We were just a new organization starting prior to this whole COVID thing. Yes. These are some sample brochures. There's 5 or 6 samples of some of the retreats that we've done. One of them we didn't get to do, but the brochure was all made, so I think it's a good indication of what we do. And we were not able to get support. So we have found that we have not been able to do the number of retreats, the amount of peer support that we want to do, and yet we constantly get asked by members of first responders, by emergency room staff, hospital staff, ICU staff. My partner here has been working with this for years. Prior to this, he can speak to his own experiences, and he can speak to the successes of the program. We're just at this point looking for some funds so that we can continue to do what we do. We would restrict the use of the funds as much as we could to the city of Fall River and whatever your support can be in the community. On our advisory council, we have Father Mike Racine, who's your fire chaplain, and
Yeah, basically it's wellness, resiliency training for first responders and veterans. Ongoing training, really what we're looking for is to do an 8-week program for any public safety, first responder officers in your area, as well as medical personnel. It's it's proven, evidence-based. I worked for 10 years at a psych hospital at an outpatient program for veterans and first responders. It's based on that model, and it's just basically resiliency training. You know, this is something that would affect the community across the board, because what you're doing is, obviously, if you're producing a better first responder, a better healthcare worker, that's going to trickle down to the community. So.
Certainly, so thank you very much. And if you could just send us a summary of what you just presented to us, we can certainly put it in with the other requests. Those types of services would be eligible under the category of public health. So, thank you again for providing us with that information. But if you could send us something, we will include it at our next ARPA meeting as part of the discussion when we're looking at allocating the funds. But those type of expenditures would certainly be allowable under the public health category. Also, Councilor Peckham would like to address you with regard to your presentation.
I just want to commend you for the work that you guys do. Me being in law enforcement, I did see the toll that it took on the guys that I work with and the women that I work with. I was told a long time ago when I first started that over the course of your career, picture a 50-gallon drum barrel, and every time you come across a tragic event or a not so easy to deal with incident at work, it's one drop of water in that barrel. By the time you get to 10, 15, 20 years, that barrel's full. I think with COVID, these incidents, the tragic events and the stresses, and compounded a lot faster on a lot of our first responders. And going back to the barrel, when that barrel's full, what happens when you put another drop of water in it? It leaks out. And the analogy that I'm using here is that water that leaks out is because you've been holding on as a first responder to these tragic events and tough situations for so long that they just build up and build up and build up until they overflow. And we know that first responders deal with very high alcohol, substance abuse, suicide, very high divorce rate. I think one of the highest occupations in the country. So again, I would like to commend you because I know COVID did take its toll on our first responders, so I appreciate your work. Thank you.
Thank you.
thank you.
Thank you.
Is there some instruction on here as to where I would send that information?
To the mayor's office.
Okay, all right, thank you.
And
Thank you,
just so
everybody.
Mary, I kept 2 copies of all the brochures that you had there, so I'll have that information go to because I didn't want to take all of your
Oh, you
correspondence.
could actually, these were only ones that I brought for the meeting tonight, so
Okay,
these are
so we
all-
can take the rest for later, but we'll have them at the next ARPA panel meeting
Okay.
that we have, so. I didn't want to take them all, but if we can take them all, great.
No, I only put together that sampling for tonight.
Thank you so
Thanks.
much.
Thank you.
I had just a question. Hi. I just had a question on the aforementioned infrastructure bill that's currently working its way through Congress. I know part of the way that they've been talking about paying for it is unspent COVID relief money. I was just wondering if there's been any inclination from the federal government that the second half of the ARPA funds may not come and be used for the infrastructure bill, or if it was allocated already and set to come no matter what.
Thank you for that question. We have not been told, or we have not gotten any indication that we will not receive the second half, but you are correct. There is some discussion out there that indicates that it will be reallocated for infrastructure.
Okay.
Anybody else?
If no, I mean, obviously, it's probably the heat or a tough night, but I know you were people that came tonight, and we appreciate everything you said. But if nothing further, we'll adjourn the meeting, and again, we'll see going forward if the committee, or after we have our next meeting, decides to have another one, or decides to look at some ways to work with the people that did make presentations both tonight and at the last meeting. But again, thanks for coming, and I appreciate all your efforts just to come out today. It's great. Thank you.
Thank you.
Thank you.